Okay, Kerri, it's now May 12th, and it's approximately 14 months since your ketamine coma.
Yep.
The last time we evaluated you was about 12 months post-ketamine coma. And we just did your pain thresholds, okay? For your upper extremity, it looks like there's been some improvement. Of course, your left side of your body tends to be worse than your right. Am I correct on that?
Yes.
Kind of summarizing it. And there seems to be some, little slight improvement since I saw you last time. Now, what I want to do now, before we go any further with that sort of discussion, I want to go through your exercises. You ready for that?
Yep.
Okay. First thing, do the vertical finger test, please.
Okay.
And it seems, looking at what you're doing right now, are you having less pain than you did last time you were here?
A little bit less, yeah.
Yeah,
Made
it
some
seems. Yeah,
improvements,
that's what it seems like. Would you agree?
Yeah.
Yeah.
She's definitely doing a little better now.
Yeah. So next thing I want you to do is take that right hand and keep your head straight and put it behind your head, please. Are you having pain when you do that?
Just a little bit here.
Okay. All right. Okay.
Not bad.
All right. Now do the left hand behind your head, please. That's a little bit more of a challenge.
Yeah, that one.
Can't get it back there, can you?
No, it starts
Okay.
to hurt.
All right. I understand. Okay. Next thing I want you to take your right hand out in front of you and make sure to open and close with your thumb, or use your thumb as fast as you can. Okay. Over on the other side, please. Do the same thing. Fast. Good. Okay. So you're still having some residual. Remember, you had an injury. Point to where that injury was.
Here, my thumb.
And that was prior to the previous 9-month infusion. So you're still having some residual from that, aren't you?
Right.
And again, it points out how important it is to avoid the re-injury phenomena in these patients. Okay, good. Next thing I want you to do now is we're going to turn our attention to the lower part of your body. Okay. And remember, you had the allodynia, and I want you to point. I'm going to ask your dad to point to where the line was going up her leg. Do you remember where that was?
It was about here.
Right there.
Right?
That's right. Right about. That's correct.
A little bit, yeah. A little
Right there.
lower, but
So
yeah.
now I want
Lower,
you.
about there?
Yeah,
Okay.
Kerri, I want you to go down there and see if you've made any improvement as far as how far you can go. Keep your eyes closed, so you.
Got there.
Right about there. Okay. All right.
About the same.
About the same. Okay. All right. Next thing I want you to do now is I want you to rotate your ankle on that right side for me, please. Good. Wiggle your toes for me, please. Okay. Hitchhike on back to Philadelphia. Okay, good. And on the other side, rotate your ankle. Okay. Wiggle your toes for me. Good. And then go ahead and there you go. You got it. Okay. Now, Kerri, go ahead and stand at the front door there, and I'm going to ask your dad to stand on your side, probably on her right side because she's a little bit stronger on that side. And I want you to just walk towards me 3 big steps, please. Very good. Walk on back, please. Very good. All right. Very good, Kerri. Now, did you have any pain when you did that?
Mainly just in my left knee.
In your left knee, point to where that pain was, please.
Here.
Right in there?
Yeah.
Okay. All right. Okay, so the next thing we want to do here is we want to get you to walk on your toes 3 steps forward, please. Your dad's there if you need him for safety. Okay, good. Go on back. Okay. All righty. And tell me about that experience as far as pain is concerned. Did you have pain now just where you said before in your knee?
Yeah, just the same in the knee.
But your toes were okay?
Yep.
Your feet were okay?
Yeah, my feet are
Okay.
Yeah.
Next thing I want you to do, it's always been more challenging for you, okay? And your dad's there if you need him for balance, okay? I want you, don't use them unless you need them, okay? I want you to take 3 steps on your heels, please. Atta girl. Good job, Kerri. Now go on back on your heels, please. Atta girl. There you go. Good job, Kerri. Good job. All right, now tell me about that experience as far as your pain is concerned.
It hurts a lot in the left heel.
In the left heel?
Yeah, the
okay.
right, it's not too
Okay.
bad. But
Okay.
in the left, it hurts.
Okay, very good. All right, why don't you go ahead and sit down, please?
Okay.
And Dad, you can take a seat, please. Now, one of the things, we talked about 2 things in particular, okay? We talked about how to determine if you're going to need another 2 or 3 day. In your case, I recommend at least a 3-day ketamine infusion. I recommend they get it higher than 50 milligrams an hour, okay, to get the maximum benefit. You're going to go in and get these things done if they can, to get it higher, okay? And to minimize the midazolam and maximize the ketamine, okay? I'm going to recommend very strongly that you do your best, and I'll write a prescription for it, to do the heated pull exercises. And we talked about not only because that's least likely to result in re-injury, but it's a way you can measure exercise tolerance, which is going to be your most reliable way to determine if you're going to need another ketamine infusion. Because pain, as you probably have learned because you're a trooper at it, it's very hard to gauge your progress with just the pain signals, okay, going to your brain. And that's why we generally say to the significant other or the caregiver, we say, What word is it it's the four-letter word we try to avoid?
I'm not allowed to say.
I can always beep it out. No, we do beeps on videos, you know.
PETA.
PETA. Yeah, that's right. Yeah, it's the pain word.
Yes.
But it's okay for you to use the F word, okay?
Functionality.
Functionality, exactly. So focus in on function, okay? As opposed to pain. And listen, this is a disease that does things to the mind, and it's a very mental process you have to go through with this disease. Okay, so very good. Now this is a chance to ask any questions at all. Let's turn to your dad first. Do you have any questions about anything?
No, I think she's been doing well, and yeah,
yes, she has.
She's got improvement yet to go, but she's doing really well, and
right.
we're really proud of her. She's
yeah. She's certainly has done that, and I expect her to continue to improve. Kerri, do you have any questions?
No questions.
Okay, very good.
Thank you.
You bet.